Almost everyone knows someone who uses cannabis, maybe for medical reasons, recreational, or both. In part 1, we explored your body's natural cannabis-like system and how it works. At part 2, we are diving deeper. Cannabis plant contains over 100 cannabinoids, which include CBD and THC. This is part 2A, and I'm focusing on CBD and CBG cannabinoids. If you want to hear about THC or synthetic cannabinoids, those are in upcoming parts 2B and 2C. A quick disclaimer, I'm not a cannabis expert. I'm sharing a focused review of the research with a beginner's eye, curious, not biased. Experiences vary, and with cannabis, there's less standardization. So it's possible that your experience may be different. Let's review again what are CBD and CBG and what are their effects. CBG or Cannabigerol, the mother cannabinoid, can turn to both CBD or THC. Early research shows few interesting findings. One is anti-inflammatory effects. In animal studies, CBG reduced inflammation, suggesting a possible role in colitis and gut health. Second is neuroprotection. In mouse models, CBG showed early signals of protecting nerve cells. Lab animal studies hint at antibacterial activity, appetite stimulation, and actions on pain inflammation pathways. These are promising, but is still experimental, not proved in human. CBD or cannabidiol is a cannabinoid that doesn't get you high, isn't intoxicating, and has a low risk of dependence. It has very mild side effects, depends on the dose. It's widely used in oils, gummies, drinks, and other products. The one problem is an unregulated market. The quality is all over the place. Regulators and independent labs have found heavy metals, pesticides, and label inaccuracies in cannabis products. CBG products are even less standardized than CBD. This is why it's very important that you buy products from licensed, tested, legal sources. CBD's clearest medical use is specific childhood epilepsies, backed by rigorous trials and medical guidelines. In other areas, evidence isn't definitive yet, but looks promising. One of them is anxiety. What is anxiety? Many people report feeling calmer when they use cannabis. People can have different understanding of anxiety. The key is to separate anxiety symptoms from anxiety disorder. How do I differentiate them? I'll cover this more in a future video. For acute anxiety symptoms, one-off situations like a big presentation or flying, CBD may take the edge off for some people. That's short-term symptom relief. If you try it, treat it as a complement to skills you already use, like mindfulness practicing. For this purpose, keep THC very low or none. Higher THC in this case can worsen anxiety. Because dosing is still unclear, the safest approach is to start low, go slow, and keep THC near zero. When we are talking about a more chronic anxiety disorder, we still don't have solid proof that CBD or THC treat this condition. So for treatment of anxiety disorder, it's better to stick with evidence-based care, cognitive behavioral therapy, mindfulness, sleep hygiene, exercise, and in more moderate to severe cases, the right medication when appropriate. If you want to try CBD in this situation, think of it as a complement, not a replacement. Now, the question is, if CBD can help, why take medication? This is a good question. We have different antidepressant and anti-anxiety medications in different classes. In general, medications take longer to work, but they are more consistent and reliable for lasting change. When paired with cognitive behavioral therapy and mindfulness skills, they reshape brain's anxiety circuits over time. They can bring side effects, so it's crucial to choose the right medication for each person. And honestly, many of us clinicians aren't trained as well as we should be in this matching. For example, people with ADHD may have more side effects with SSRI class, which is the first go-to by most clinicians. They often respond better to other options. I'll go deeper on anxiety treatment in my future video. So how about other mood disorders like bipolar disorder? In bipolar disorder, especially manic and mixed type, several small studies have shown that cannabis use can be associated with earlier onset, more functional impairment, more severe and frequent manic episodes, and poorer outcomes. Cannabis cessation during mixed and manic episode improves outcome. CBD is still not recommended to treat mood disorders. Avoid or minimize THC as higher doses can increase anxiety and panic attacks. A quick comparison between CBD and medications. CBD may offer faster, short-term relief of anxiety symptoms, but relatively few side effects. Results are not consistent and less predictable. Medications, on the other hand, are slower to work. It takes weeks to kick in, but steadier over time. They are regulated. We know the clear dosing, and combined with therapy, it can rewire the alarm system for more durable change. We talked about anxiety. Another interesting area is sleep. I see many people use CBD to help them sleep. It's probably due to its calming effect and reducing stress and anxiety symptoms. The studies show mixed results, and we still don't know what the best dose is. Compared to older sleeping pills like benzodiazepines or Z-drugs like Zopiclone, CBD seems safer. Although less predictable and weaker, but they have less risk of dependence or next-day grogginess. There are new medications that work differently with less risks of dependence and less next-day impairment than older pills. For ongoing insomnia, these newer medications may offer a more reliable option. CBD could still be worth to try if sourced safely. One important point: mixing CBD with alcohol or other sedatives can stack the drowsy effects, slowing reaction time and breathing, worsening next-day grogginess. CBD can raise levels of some sedatives like benzodiazepines, Z-drugs, trazodone, quetiapine. It makes them hit harder than intended. So if you try CBD for sleep, avoid alcohol and other sedatives. Use an oral form, oil, capsule, or gummy, not smoking or vaping. Take it 1 or 2 hours before bed and give each dose a few nights before changing it. Now, let's talk about another promising effect for CBD. In labs and early trials, it shows anti-inflammatory, antioxidant, and neuroprotective effects. That has led to research in multiple sclerosis, Parkinson's, Alzheimer's, and neuropathic pain. Results are promising, but not strong enough to change medical practice yet. Now, a quick note on CBD and pain. We have different kinds of pain, and I see conflicting studies. Many of them tell us that CBD alone doesn't reliably relieve chronic pain, whether arthritis, back pain, or neuropathic pain. A very recent phase 3 trial of a standardized full-spectrum oral cannabis extract showed a small but real reduction in chronic low back pain over 12 weeks, with mostly mild side effects. It was not just CBD, and this doesn't mean all cannabis products work the same. Expectations also play a huge role. In many studies, people on placebo who thought they were taking CBD also reported benefits. So, how do I compare CBD to pain medications? While CBD is not a direct pain reliever and not as strong as medications like morphine or codeine, it also doesn't carry the same risks of addiction or overdose. That means for some people, it may be worth a careful trial as long as expectations are realistic, the product is lab tested for quality, and it's used alongside, not instead of proven treatments. Think of it less as a painkiller and more as a tool that may help change how pain is experienced, is perceived. It's very important that people don't delay proper medical evaluation. Persistent or worsening pain can sometimes signal a serious, treatable condition, and relying only on CBD risks missing the right diagnosis. If you try CBD for pain, Keep the dose modest, pair with proven strategies like physiotherapy, exercise, and good sleep, and reassess after a few weeks. Don't wait for months. If pain wakes you up at night, if you have weight loss with no reason, or if pain keeps worsening, you need to see a clinician. Overall, CBD at moderate doses is relatively safe. The most common side effects are fatigue, diarrhea, nausea, or appetite changes. At higher doses, typically over 70 to 100 mg per day, CBD can affect the liver. So people with liver disease need more caution. CBD can slow one of the liver's function, which is clearing drugs off your body. So it can increase the levels of many medications, including some blood thinners like warfarin, seizure medications, benzodiazepines, antidepressants, antipsychotics, and certain heart medications. If you are on any of these, keep CBD doses lower and consult with your doctor or pharmacist. About ADHD medications, we don't have a solid research on mixing cannabinoids with stimulants. Some people feel fine, others get more side effects with meds or less benefit. If you take methylphenidate or amphetamines, what we know is to avoid high THC products. There isn't a proven dose for anxiety or sleep. If you choose to try CBD, use a start low, go slow approach. Begin with a small bedtime amount, for example 5 to 10 mg. Keep THC near zero and adjust gradually over a few nights only if needed. Stop if you get side effects and talk to your clinician, especially if you take other meds or have liver issues. If you're going above 70 to 100 mg per day or have liver disease, make sure you check your liver enzymes. Before we go further, a quick note for specific groups. For children, only under specialist care, mainly for some kinds of epilepsy. Also, store CBD edibles safely. Kids can mistake them for candy. Cannabis is not advised during pregnancy or breastfeeding. We lack safety data. And for older adults, especially those on multiple medications, again, start low, go slow, and watch closely for dizziness, sedation, or drug interactions. From a public health perspective, there are more concerns. People may waste money on ineffective or contaminated products. Worse, they may delay proven treatments for serious conditions, hoping CBD will do the job. My take-home message: buy tested CBD from licensed retailers. Use it as a complement, not a substitute. That's the best of CBD and CBG. Next up is part 2B, THC, the part that makes you high. Why today's products hit harder, what changes in your brain, and how to lower your risk if you choose to use THC. Thank you for watching, and we'll see you on part 2B, THC.